Hello, everybody. Good afternoon. Uh, First of all, I would like to thank the International Alliance for giving us this platform where we can provide insight into how we manage ALS in India. Next. Take a- Okay. So, why we were not there in the alliance for all these years is because in India we are the first foundation who are exclusively focusing on management of ALS and helping patients of ALS or MND and their families. We were founded in 2011, so we are a very young association, just working for 4 years, and we are looking for guidance from all of you who have been working with patients like me for so many years. Now, I've been a physician and I had read about ALS in my MBBS, in my MD days. But I got the real insight about ALS when I myself got diagnosed with ALS in 2004. I completed my MBBS undergraduation medical school from India, Mumbai, and then I went to New York where I completed my MD internal medicine from New York Medical College. And then I was practicing in New York. Till then, I was totally healthy, no problems. And suddenly, the diagnosis of ALS daunted me in 2004 when I started having difficulty in my writing. At that time, I was given the standard prognosis, which just shattered my world, my dreams, and I could not continue working, so I had to come back to India to my parents, and I could not see any hope at that time. When I came back to India, I saw that there was a lot of unawareness. Like, people did not really know about MND or ALS. It's not that it's not present in India. It's just one lack of awareness. Because in India, the more focus is on the infective disorders and less upon the incurable chronic neurological condition. So every now and then, every person I met, I had to tell them about ALS, the whole story again and again, which really upset me. And I thought, if me being a doctor, I'm facing such hard time to cope up with my problem, what about the other lay people who are facing this difficult disease in India without having the right kind of guidance or atmosphere or even the infrastructure? And that's why I decided to start this Asha Eco Foundation. In India, our native language, Hindi, hope is called Asha. And that's how I came up with this name. And our mission is to build hope and positivity in the lives of people with MND and their families, and to empower them with the proper knowledge and guidance so they can cope with the difficult disease with confidence and dignity. Next. So, in these 4 years since we have started, we have faced many challenges. I'm a physician. I started the foundation, but I don't really have a social background where I can, I have that training about how to run a foundation. So right now, we are just a startup organization, and we have been working uh, for these 4 years. Whatever challenges are there, I'm sure a lot of you must have already faced these in the beginning years. So I have divided it into patient and community related, medical and rehab system related, and funds related. Next. So patient and community related. First of all, in India, patients themselves hardly know about this disease, and a lot of times they are diagnosed at a very late stage. And at that advanced stage, to provide services becomes all the more challenging. As we all know, MND does not have any definitive diagnostic test other than the EMG conduction, which can be a normal test in the early stages. So a lot of people get late diagnosed. Incomplete guidance regarding the course ahead. A lot of doctors are not very well trained in ALS. We read about it, but still they are not totally aware about the whole course. And therefore they are not that well equipped to even guide the patient. Lack of multidisciplinary approach. ALS, as we all know, requires a team of professionals from different areas to provide a holistic care to the patient, the caregivers, and the family. In India, we don't have any MND clinic or any team that focuses on ALS. So now we have started this venture of MND clinic in Mumbai, which we are thinking of providing in multiple cities. How to break a bad news? There's a debate about whether the patient should know the complete truth. In Western world, I've been trained, so I know both sides of the coin. And both the sides have their own pros and cons. So in India, there's a cultural influence that restricts us to give the bad news to the patient directly without informing the families. We have to take the family, the spouses, into confidence and then sit with them and the patient and then break the diagnosis. So guiding an uninformed patient. A lot of times families would say that no, please don't tell my mother or father about this disease, and they will completely break down. So then it's a big dilemma. And an uninformed patient is more challenging to guide because if we tell them to do something, then they would say, why? What's going to happen? So that's a big challenge. Next. Bringing the patient to the care facility. So lack of resources, transportation difficulty, bring the patients out of the home which does not have any lift, lack of manpower, the expenses, the long distances, and if the patient is in the advanced stage, it becomes all the more challenging. And then lack of motivation in the patient and the families to get the patient to the service center becomes difficult. training the patients for devices is majority of the time everything is in English, which is not necessarily a language that our patients or families understand. Lack of other infrastructure and basic amenities like water, electricity, sterilization facilities, etc. Limited earning potential in the rural areas. They cannot give time. If the patient himself is the sole earning member, then it becomes all the more difficult. Next. Medical and rehab system related, we do not have a national registry. So I'm looking forward to the Asia Pacific Consortium where we can take this initiative. Lack of experts, proper referral system, undertrained professional, the long-term costs involved, few multidisciplinary care hospitals, and the process to get Riluzole is very tedious. So we have, our foundation gets it from the company and provides it free of cost to the patient. Funds related, fundraising itself is a challenge because the community awareness is low and there are a lot of legal issues. Like for a startup organization, we have the online payment is not available for 10 years, and tax rules are difficult. Funds allocation is a challenge. And the other thing is, because we don't have enough funds, we can't obviously support big research funding because the preliminary research that our foundation has supported has preliminary good results, but we need more funding. So the future plan is to create more awareness, distribute guidebook. Recently, we have written an ALS guidebook for patients and their families. I have the CD. It's written by the professional. So if any of the foundation needs the CD, we can give it to you. We are looking forward to making a mobile app, collaboration, work towards registering, and the multidisciplinary clinic. No, next. It's online FaceTime and Skype consultation, home assessment, home visits, multiple chapters all over India, workshops, events, and fundraising events. These are our plans to overcome the challenges. So despite all challenges, let's find the cure for Hemangi ALS. Thank you. I would like to thank my team and my supporters, Neurogen Brain and Spine Institute, for this presentation. Any questions?
There's the time for questions.
I just want to say I'm probably speaking for everyone here, but thank you. I commend you for what you're doing and for thinking of everyone and establishing this much-needed resource in India. So thank you so much. I also wanted to ask, are there any other neurological-related organizations that may be able to support you?
Yes, there is a multiple sclerosis organization, which is a big one, which have been working for more than 20 years, and we are looking for collaborating with them. The talks are on. Thank you.
Thank you for your courage to do what you are doing in almost impossible environment which you are working in. But just one question, how many patients do you know of or have contact with?
I don't know whether I can speak about the research in the foundation. That I didn't say anything about the stem cell therapy, but in our foundation, overall, we have 120 patients, and out of that, 75 people have received autologous bone marrow mononuclear cell transplantation, which even I have got. And I have received it in 2009. And since then, my progression has halted. So from 2004 to 9, I was progressing, and for the last 7 years, it's totally halted. And like me, I know of another 25 patients whose progression has been altered because of the stem cell therapy. We are presenting a poster in the symposium 271. So if you want to know more, please visit us.
Thank you very much for highlighting so many challenges that you face in India. I'm just wondering how you reach out to people in such a vast area. Do people from around the country make contact with you and get support from your organisation?
We have a website, we have a Facebook page, we have a Twitter page, and since in India we are the only organization working for ALS, they do contact me from all over India. And me being a physician, I have a lot of contacts with other neurologists, physicians in the Indian Medical Association. So we do get reference from the doctors.